The immune system. The immune system is the body's defense against infectious organisms and other invaders. Through a series of steps called the immune response, the immune system attacks organisms and substances that invade body systems and cause disease. A properly functioning immune system is one of the keys to a healthy, happy animal who will resist infections, allergies, and chronic illnesses. An immune-mediated inflammatory disease, or IMID, is any of a group of conditions or diseases that lack a definitive etiology, but which are characterized by common inflammatory pathways leading to inflammation, and which may result from or be triggered by a dysregulation of the normal immune response. These include inflammatory bowel disease, allergies, hives, laminitis, and many other conditions in our animals. Recurrent or chronic infections only occur when the immune system is weakened. Animals with diagnosed conditions and heavy parasite load are ones that are sure to have a weak immune system. Under such circumstances, there is a repetitive cycle that makes it difficult to overcome the tendency toward infection. A weakened immune system leads to infection. Infection causes damage to the immune system, which further weakens resistance. In either case, enhancing the immune system can provide the answer to breaking the cycle. The cornerstone of good health is a properly functioning immune system. As we learn more about the immune system, we are prompted to shift away from treating illness and begin working to prevent it. This approach begins with a focus on strengthening the immune system. Strengthening the immune system of the entire animal world, starting with the newborn, should be a top priority for all animal caretakers. The immune system consists of the tonsils, adenoids, thymus, bone marrow, spleen, appendix, Peyer's patches, lymph nodes, and circulating white blood cells. Many of the characteristic symptoms of illness, from nasal discharge to fever and swollen glands, are signs that the normal immune response is proceeding on schedule. These symptoms represent the body's best efforts to heal itself. By treating symptoms, we are suppressing the body's natural response and inhibiting the healing process. Instead, we attempt to support the body's defenses to allow for completion of the healing process. Anyone that has read a textbook on physiology has seen that the nervous system plays an important role in both the control and activity of the immune response. Dr. Robert Adler performed the key experiments to prove the brain-nervous system-immune system connection. The central nervous system is linked to both the bone marrow and thymus, where immune system cells are produced and developed, and to the spleen and lymph nodes, where those cells are stored. Researchers have found that inducing an immune response causes nerve cells in parts of the brain to become more active, and the brain cell activity peaks at precisely the same time that levels of antibodies are at their highest. The brain monitors immunological changes closely. Whenever the immune system deals successfully with an infection, it emerges from the experience stronger and better able to confront similar threats in the future. Our animal's immune system develops in combat. If, at the first sign of infection, we always jump in with antibiotics, the immune system is not given a chance to grow stronger. Andrew Weil, MD, in his book Spontaneous Healing. The nervous system controls the entire growth and development of the immune system. This means that a properly functioning nervous system should be the first priority in strengthening the immune system, since it is the nervous system which controls all of the bodily functions of an animal. The nervous system works by sending and receiving nerve messages, or impulses, to all parts of the body. The nervous system is protected by the spine, consisting of a variable number of movable vertebrae, depending on the species. When the spine is in its proper position, it protects the nerve pathways. But when vertebrae become misaligned, interference to the nerve impulses occurs, which reduces the overall functioning of the nervous system and of the particular organ to which it is assigned. These spinal misalignments are known as vertebral subluxations. The effects of vertebral subluxations have been well documented by leading scientists and researchers from all over the world. Dr. Chang-Ha Su, PhD, University of Colorado, stated, "Subluxation is very real. We have documented it to the extent that no one can dispute its existence. Vertebral subluxations change the entire health of the body by causing structural dysfunction of the spine and nerve interference. The weight of a dime on a spinal nerve will reduce nerve transmission by as much as 60%. As early as 1981, an article in Science reported nerve dysfunction is stressful to the visceral nerve and other body tissues, and the lowered tissue resistance modifies the immune response and lessens the overall capability of the immune system." An experienced animal chiropractor will determine the presence of subluxations via motion palpation and finding abnormal movement between adjacent vertebrae in your animal's spine. As these subluxations become more severe, you may notice an alteration in how your animal moves and reacts to their surroundings. A leading researcher in the field of manipulation medicine reported about spinal nerve interference and immune disorders. He stated that blocked nerve impulses in the cervical region can cause many clinical features, from central motor impairment to lowered resistance to infections. Chiropractic examinations are of a decisive importance for diagnosis of this blocked neurological flow. Chiropractic can often bring about successful results because it aims at the cause of the problem. The science of chiropractic is founded on the premise that a proper nerve supply is essential in controlling and regulating bodily function. By releasing stress on the nervous system, chiropractic permits the immune system to function more effectively. Studies done in Australia that measured the effect of chiropractic treatment on the immune system have shown that chiropractic may influence T and B lymphocytes, NK, natural killer cell numbers, antibody levels, phagocytic activity, and plasma beta-endorphin levels. A recent study by Dr. Ron Perro, a leading cancer and genetic research specialist, found that chiropractic patients of all ages had a 200% greater immune competence than people who had never received chiropractic care, and a 400% greater immune competence than people with serious diseases. Recent research by Patricia Bennett, PhD, suggests that spinal adjustments may have a direct effect on certain aspects of immune function. Her group showed that when the middle of back was adjusted, the ability of white blood cells to release reactive superoxide radicals and hydrogen peroxide as they came into contact with different bacteria or fungi was enhanced. Routine chiropractic examination and adjustment of your animals should become as important in your wellness program as vaccinations and deworming. Injecting vaccines into an animal with a weak or overactive immune system will lead to a false sense of security. For healthier animals with a strong immune system, schedule an appointment with your AVCA certified animal chiropractor today.